afternoon, everybody. So, there's been a lot of questions, especially this year, about Medicare and Medicare replacements, and a lot of residents are concerned. And so we wanted to put this presentation together. Mrs. Miller actually mentioned it to me. The thing that I want you to know, I don't want you to be staying up at night worrying about this stuff, right? But there's a lot being said right now. Like, what's going on? I can't even watch the TV anymore without seeing a Medicare commercial about every 5 minutes, right? They've got this guy talking about it, Joe Namath talking about it, Dynamite guy, I don't even know what his name is. They've even got Captain Kirk talking about it. So it's got to be serious. Well, hopefully you realize that what's happening is something that happens every year. And it's annual open enrollment time. And it's a great time to be a senior, right? It's open enrollment, you have options, right? There are Medicare replacements out there. And we're going to talk a little bit about those. Some of you are on the UT program and it's switched to a PPO. And some of you will find out that, sometimes Medicare replacements aren't all they're talked up to be. There's a lot of hype. You're going to get free dental and vision and meals, and we're going to give you money back on your Social Security. And a lot of times, there's some fine print that talks about those things being an introductory period. Or they talk about dental benefits, but it's really not a very, very robust dental benefit, okay? So myself, Debbie Pearson, one of our residents who's very talented and skilled when it comes to understanding a lot of this. She owns a company, Care4, is going to help us talk through some of this. We'll try to answer some questions, and we'll talk about this towards the end from Westminster's perspective. We don't recommend insurances. That's not our job, right? We really aren't going to tell you what is the best insurance, what brand you should have, because there's 8,000 different types of insurances out there. And you really just need to do your research and work with people that know to help you through the process. Just because there's an open enrollment period doesn't mean you need to change anything. If you're on a traditional Medicare and a supplement, fantastic, right? Your out-of-pocket expenses are going to be almost nil. If you are on a Medicare replacement, there are some caps to your out-of-pocket expenses. But there are some plans that are worse than others. You can pay as much as almost $8,000 a year in out-of-pocket expenses if you're on a certain Medicare replacement plan. You can join, switch, or drop during this open enrollment period. It runs every year. So even if you're not on something you like and it's too late, if it was too late to change, you can always change it next year, right? You can join, switch, or drop your Medicare Advantage plan. You can go from Medicare Advantage back to traditional Medicare. It might cost you a little bit more, and vice versa. You can go traditional Medicare back to a Medicare Advantage plan. There's also Medicare prescription drug plans that you can join during this time. And I'm going to turn it over to Debbie Pearson, and she's going to talk a little bit about it from not only case management perspective, but also from resident perspective. Debbie? You want the clicker, or I can do it for you?
I'll do it.
Okay.
Yeah, it's fun. And tell me if you can't hear me, because my voice doesn't necessarily carry louder. Okay. Just raise your hand anytime that I need to put the mic closer and be a little louder with you guys. I come to this as a resident, but also someone that has been dealing with Medicare, Medicare Advantage, and all the other plans for decades with the patients that I work with. It's complicated, and everyone's in this rush for this date, October 15th through December 7th. And Chuck's already covered this. One of the first questions I ask people, and I see a lot of patients on an introductory first time doing their assessment, and I'll ask them what kind of medical plan they have. And they'll bring out their red, white, and blue card and show me they have Medicare. And then I'll ask for their supplement, and they show me their Medicare Advantage plan. There's a ton of confusion. We've even been confused with Hank, where we thought he had an Advantage plan and a drug plan, when really what he was doing was carrying around his drug plan from 4 years ago in his wallet. It was no longer effective. So the important thing is to do everything you can to understand what that United card is, the Advantage plan, the Aetna card, the Cigna. Is that your primary and only insurance, or is it a supplement? And then you'll know if you want to make a change or not, based on that. So are you here because you want to make a change? Is anyone here interested in making a change? Is that why you're here? So there are people looking at that. Okay, well, we had a great deal of fun, Hank and I. We are a house divided. I have traditional Medicare. I will never, ever, ever give it up. Hank has gone rogue. He's a retired teacher, and he has this Medicare Advantage plan. Not that he thinks it's the best plan or the worst plan. He's a loyal fella, and so he has the TRS Advantage plan. We were talking about it and decided we would do an experiment. He's been happy with it, but for this group, we decided we would go through the process of disenrolling him, taking him off of an Advantage plan, and going to traditional Medicare, the original Medicare.
How could you?
I know.
It's horrible.
I know. We already knew the plan we wanted. It was exactly my plan. He was going to follow my plan, so we didn't have to go through all the decision tree about what drug plan to use or anything. And the result last week was we spent 2 hours we will never get back. We have more questions than answers. We're still undecided, and then we'll go from there. There was nothing we could absolutely do. So that is because we wanted, if he was going to come out of an Advantage plan, we didn't want to just switch to Medicare. We wanted to have Medicare, we wanted to have Medigap, and we wanted to have a drug plan. That's where it gets confusing. If you want to just give up your Advantage plan and go with Medicare A and B, have no supplement, no drug plan, it's pretty easy. But if you want a fully loaded plan, you're going to have to be willing to sit and devote yourself to the process. And probably everyone knows this already, but I'm going to go over it. Medicare A is that free Medicare, free because you paid your entire working life in taxes. It's not free, it's prepaid. You have bought your Medicare A plan during your working years. That covers hospitals, inpatient nursing. A is the expensive part where you are inpatient and you will not be paying for that. Medicare B is the outpatient, the doctors, the human bodies. That's what I call the B part, where it's for outpatient services, equipment, that type of thing. You're going to pay for that. C is the combination of A and B. And like Chuck said, it throws in some extras along the way. You can get some dental cleanings, you can get your vision checks, you may even be able to get pills that are sent to you for free, supplies. C is your combination of A and B that also combines, in most cases, drug plans and some extras. D is your drug plan. If you decide at some point you want to come out of an Advantage plan and get on a drug plan, it's pretty easy, relatively inexpensive. What can cost you is getting the Medigap that pays some of the co-insurances, the co-pays, that type of thing. And I'll go over the costs in a minute. Does anyone have questions about that before I go on? Because you've got A, B, C, D, and Medigap. The cost, A is no cost at all. B had a standard cost until probably maybe 8 years ago. Seems like 8 years, maybe a little bit more. Everyone paid the same amount for Medicare B. And then the government decided that's crazy. You know, we're gonna have someone impoverished paying the same thing as a millionaire. So they adjusted to Medicare B. There are people that are impoverished who pay nothing for their Medicare B because it's routed through their Medicaid. But anyone with still a decent income is paying a lot more than $170 a month. So it's adjusted for income. You have to have A and B to ever get on an Advantage plan. If you don't have those two, because remember C combines the two of them. You can't combine what you don't have. So you've got to have Medicare A free, and you've got to have Medicare B for a monthly cost to get into an Advantage plan. When you do get into an Advantage plan, at first blush, it looks like this incredible bargain to everyone. You will probably pay less being on an Advantage plan than you will putting together A, B, D, and Medigap. So originally it looks like a bargain. And for some people that have no medical complexities, they're just well and they're gonna be well until the day they die, an Advantage plan works really well. The supplement is a problem if you haven't gotten it originally, because the supplement is an insurance company and they don't want to take on people that have complexities. That's where the rub is, trying to go from an Advantage plan back to the original Medicare. I'll tell you about the Advantage plan, which I wish they had named it something else. It might be more realistic, a combined plan, a simple plan. But it's like your HMO or your PPO. Did anyone live the life of an HMO or PPO during your earning years when you had insurance through your employer? Did you have some frustrations with it? Because an HMO is a completely closed network. You gotta use everyone in their network. A PPO wants you to use people in their network. However, you have the option to use people outside at either a higher cost or you just do it on your own. You pay out of pocket. There are a limited network of providers, and the problem with that is if something bad happens or something where you cannot get the care you want, let's say you have a very unique form of cancer that's not treated here, but is treated successfully at Johns Hopkins or MD Anderson, and they're not in the closed network of your Advantage plan, you can absolutely go and get care there. The question is, do you pay a huge amount to do that, or do you pay every penny of it? So that's some of the disadvantage of an Advantage plan. Another one is you got a gatekeeper. You got a primary care doctor, and if you want to see an endocrinologist, you're worried about your thyroid, seems to check out okay, but you want more expertise on what your dose should really be, so you'll feel right again. You gotta make an appointment with your primary care, and the primary care has to buy off on the specialist, let you know that it's okay with them, then they have to find the specialist and then start the referral process. So you have out-of-pocket costs for your co-pays for the primary care, your co-pays for the specialist, the pre-authorization waiting period, and then you can get where you need to go if the insurance approves that. And some plans do have some dental and vision. We have it because of Hank's plan, and it helps. Hank has a love for dental implants. Loves them. And he depletes all of his dental visits and all of the dollars, what do you say, 3 months into the year?
If that.
If that,
Maybe
okay.
1 month.
1 month, okay. But truly, if you are generally well, if you are pretty much okay with your primary care treating the vast majority of what you have going on, an Advantage plan may very much be an advantage to you. You have to decide on your own. Traditional Medicare, any doctor out there, any hospital, any skilled nurse facility, anyone who accepts Medicare, you can walk in the door and be seen. That's a huge difference between the two. That's a huge difference why, as a bossy nurse who knows exactly what I want, I could never be in an Advantage plan. Hank, on the other hand, is happy as a lark. Whatever his doctor tells him to do, going through the primary, it works for him and it works well. And it may work for many, many people. The Medicare guidelines are followed. I like the fact that I don't have to look at it every year or think about it. I just have original, and it stays the same year after year. You will have to, if you want fully comprehensive everything, then you're going to need your Medicare A, B, D, and Medigap. You can skip the combined plan, but you'll need those 4 if you want it completely comprehensive. Otherwise, you can have the combined plan, the Medicare C, and go that direction. Now, changing from traditional to an Advantage plan, has anyone ever done this before? Was it just the easiest thing in the whole wide world? I don't know if you heard what she said. Say it again.
It was too easy. It took me 2 years to figure it out.
Louder.
She said it was too easy, and it took her 2 years to figure it out. It is the easiest thing you will ever do. They have filled your mailbox. They have filled the little discard place in the mail rooms where you throw everything away that's junk. They filled your emails, your text messages, and your phone calls. They want you. They want every person in here. Everyone is accepted. And if you don't like your plan, let's say you're with Aetna and you're going to stay with an Advantage plan, But you want to try someone new? You can change that during open enrollment every year, and it's a pretty simple process. Change from advantage to traditional. That's where Hank and I surrendered some of our time. It is so hard. And I'm going to try and explain this in a way that makes sense, but I may not. So if I get through it and it has made no sense, please stop me and make me go through it again. We got on the phone, and first of all, we had to find a broker who goes from Advantage to Original Medicare. All these brokers that are signing up Advantage plans, they are licensed to go Medicare to Advantage. You have to find someone that can go both directions, and it has to do with their licensure. So we tracked around until we found a really nice guy, and I've included his name. It's a 800 number. I don't know him personally, but he worked with us and he was patient. And we said, although we maybe didn't mean it, it was just a test run, we said that Hank wanted to leave the Medicare Advantage and go back to Original Medicare. We could do that if that's all he was gonna do. He was just gonna have A and B, no supplement, no drug plan, nothing. That would have been easy, but we don't like easy. So we said, no, we're gonna take out a Medicare supplement, a Medigap. We had to go through underwriting. Do y'all know what that means? Underwriting is where the insurance company decides if they want you or not. And we go through the list and they ask 40 conditions that you can answer yes or no. Like osteoporosis with a fracture, heart attack in the last 2 years, Parkinson's, dementia. They go through all the list. And if you say no to every single one of them, then they can turn it into the insurance company to see if they will allow you in or not. If you say yes to any of them, which a lot of us could say yes to some of these, then they can still send it to the insurance company for underwriting. But you have less of a chance of being approved. Well, Hank said no to everything, and he said, well, I'll send it to underwriting. So we are waiting currently to see if Hank can get in the lucky door or not. But we have to wait on that, keep his Advantage plan, wait on that until we get something back in writing, by email or in the mail, that says he is accepted. So we got through that hurdle, and then the drug plan. We had to name all the prescriptions he's on, what he's on them for, and that, for some reason, I guess just the cost of drugs, that's a lot easier. You don't have to go through underwriting for a drug plan. So even if you're gonna fail underwriting, you can still do your Medicare A, your Medicare B, and your Medicare drug plan, and just go without a Medicare supplement. So you do have options. We're waiting. If they get back to us by December 7th, we'll be happy. And at that time, it's out of my hands. Hank will decide, but you never cancel one policy until you are assured of getting the next one. Does that kind of sort of make sense? Okay. Why is there all this advertising? Does anyone know why? Yeah, Medicare wants to outsource this mess. It's a lot of work. Also, the people that are calling and sending things, they get a commission for every single person that signs up. And I tried to get the amount out of the guy, and he wouldn't give it to me, but somewhere between $50 and $150 per person for everyone that gets signed up. So they have a real incentive. It's a for-profit business, and the insurance company is offloading all the administration from Medicare. So there are a few layers there. First of all, there's the layer of your health care cost. On top of that, there's the layer of their administrative cost. And those layers have to come in costing them less than if you had used your own traditional Medicare. So they have to provide or cover fewer services if they're going to stay in business, and they all seem to be thriving. If you have had no problems at all, you're on an Advantage plan or you're on a traditional plan and things are going well, I would not go through the hassle of changing. The only thing that sits in the back of my mind is the underwriting. If you can go through underwriting and get back on traditional this year, will you still be able to do that next year? So if anyone is uncomfortable with their Advantage plan, it might be worth 2 or 3 hours of your time to get on the phone and see if you can pass or not. If you're happy, we're very fortunate because everyone here is smart enough to have bought into life care. Because if your health insurance falls short, Chuck has some answers in this community that the vast majority of people don't have. So we have some fail-safes, but it's important to be comfortable with your insurer if you can. The numbers that I was able to find was the Medicare, traditional Medicare number, and you can call, and they have some nice grids where you go through based on your clinical picture, your drugs and all that, and they can advise you which plans will best cover your current illnesses and your drugs. They cannot enroll you in anything. They're just providing information. And Medicare also has a phone number for anyone going from traditional to an Advantage plan. They'll give you that on their 800 number, and they will enroll you in that second number. The third number is our friend Jamie. Jamie, some random broker at these 800 lines, it's called Clear Match Medicare. And he's one of the brokers that can go both directions. I don't think you need to call him if you want to go to an Advantage plan. Anyone will give you right. They'll give you that. But if you want to go the other direction, he was very patient, very helpful. So, not that I will have all the answers for anyone. It's just impossible. Medicare doesn't have all the answers when I call. But are there any questions you think I might be able to answer? Yes.
Does Medicare, plain Medicare, have an out-of-pocket maximum for the year?
Does Medicare have an out-of-pocket maximum for the year? They're bound to, but I would think they're in different areas. You've got your skilled nursing, you've got your hospital. I don't think they're maximums for their B. I'll tell you what, while Chuck's talking, I brought my Medicare book with me. I'll look it up. Will that work?
Yeah.
Okay.
Do you endorse this document about why Medicare Advantage bad?
Some of it, I mean, people have been very happy with the Advantage plans, but I have had, in my personal practice, I've had a lot of disappointment with Advantage plans that I haven't had with traditional. But I work with a lot of people that are extremely medically complex, and I think that's where the dividing line is. If you're complex, and if you want to drive your own medical care and make your decisions and go to who you want, when you want, that's traditional Medicare.
How would you know to make those judgments?
How do you know to make those judgments? Do you have an Advantage plan currently?
You're about to.
We're about to.
Okay, so you haven't experienced it before,
No, but
but you want to know if you should actually go forward with it or not.
He's with UT, so he's gonna have no choice.
Yeah, that's what I heard. UT has gone into that. But they're doing a PPO plan or an HMO, do you know?
PPO.
PPO will give you the choice, and that's what happens with
PPO stand for?
a preferred provider organization. So they have people they prefer, but you can go to their preferred people or not. But this is like any big organization that changes. You either opt out and take traditional everything now, or you can risk it down the road, and you haven't had a chance to try it out yet.
Are the companies that doing this doing it for profit?
They are all for-profit companies.
So our health care is for profit.
Correct. Correct. The difference is Medicare has guidelines. And do y'all get those Medicare books every year? Has a Medicare book where you can open it up, you can see what you have, you can see what you don't have, and you can know the roadmap for you. An Advantage plan is the gatekeeper to get all of the things that Medicare says they're going to give you. So you have to make that decision if you're going to go with it for a year. When we had it with teacher retirement, as soon as they went to an Advantage plan, I jumped off immediately, because at that point, you don't have to go through underwriting. You are already insured. You can opt out, go to traditional, and have no underwriting because you already you've already qualified. If you wait a year and decide you don't like it, then you go through underwriting. Okay? All right, thank you.
I appreciate that. And we're not trying to scare you today. The white papers and information, so there's a one-sheet document that has all the Medicare resources on it. Also, there's an article, and it's Why Are Medicare Advantage Plans Bad? It is an article that I pulled off the internet that it tells you about Medicare Advantage plans and what you need to look for when you're exploring them, right, as options. Or when you move to a Medicare Advantage plan, it's just questions that you can ask. And you know, PPO is much better than an HMO, but there are Medicare Advantage plans that are HMOs, so you have to be careful out there. I'm gonna go through just a couple things that, a few things that you should be aware of when you explore Medicare Advantage plans. Things that you should check on before you switch. How many people in this room have traditional Medicare? Oh, yes, keep it. How many have a Medicare Advantage plan or going to a Medicare Advantage plan? Okay, all right, and there are good Medicare Advantage plans. Like, you can ask these questions. Check whether or not your doctor is in the network, right? And if your doctor isn't in the network, then who is? You can ask those questions. It may require some legwork on your part, but you can find out that information from the provider. Not comparing prescription drug plans. There are formularies out there. You can check and see whether or not your medications are covered by the formulary and whether you're gonna have to pay out of pocket for those. But ask those questions. If you're using, most of us have been on the same medications for several years. Are any of us complex? I am. I'm complex. Nobody else is just the front row and me. Okay. Well, I'm guessing that a lot of us are complex. We've all got a lot of stuff going, high blood pressure, diabetes, I have both of those, whatever. But, I'm complex, and I take medications. I want to know whether or not those medications are going to be covered, right? So you can ask your physician to provide you a list. You have a list, check that against the formulary for these medications. You can go to Medicare.gov and see what plans they suggest for you. If you log into your account at Medicare.gov, your medication history is already there. Thinking all doctors will take your PPO plan. That is not the case. That's not always the case. Your doctor may not be covered by the Medicare Advantage plan. You can talk to your doctor and try to get him or her to be in network with your PPO plan. Sometimes that works. Number 4, being swayed by the splashy ads. Why are Medicare Advantage plans in business? To make money. All insurance companies are in business to make money. They are making money on you. And by, Medicare, the government are looking for ways to save Medicare, right? They're looking for ways to make Medicare last many years into the future. And so one of the ways they're doing that is by privatizing Medicare. And that's what these Medicare Advantage plans are. It's a privatization of Medicare. And they make money by managing down the expenses they required to provide you medical coverage. And so, there's a lot of pre-authorizations that are required. Even if you stay in our healthcare center under Medicare, a Medicare Advantage plan, we have to get a pre-authorization for your coverage. And one of the things that's not great about Medicare Advantage plans, say you fall and break your hip and you end up going to our healthcare center, and that Medicare Advantage plan says, oh, broken hip, we're gonna give you 2 weeks, right? We're gonna cover you for 2 weeks. What if it takes you longer than 2 weeks to recover? Well, if you're 95 years old and you fall and break your hip, chances are it's gonna take you longer than 2 weeks to recover. And, without those pre-authorizations in place, they'll stop coverage. Now, the beauty is, you all live in a life care community. So even when your Medicare runs out, you can stay in our healthcare center on your life care benefit, right? And we're gonna take care of your nursing and your room and board. You'll have some additional expenses if you require additional therapy. Whatever's not covered by Medicare Part B or your Advantage plan will be your responsibility. And I'll talk about that in a minute. Waiting too long to ask for help. So open enrollment is here. It lasts till December 7th. Reach out to your family if you're not sure. Reach out to your family, reach out to some of these resources and visit, ask the questions that you're concerned about and make sure that you're going to be covered the way you want to be. 3 disadvantages to a Medicare Advantage plan, and Debbie spoke about this. There are differences in coverage. Not every Medicare Advantage plan is the same. You need to read the fine print. If you can't read the fine print, find somebody that can, right? You need to pay attention. A lot of times, services will be introductory services, and they'll stop after 12 months. Don't get fooled by the bait and switch, right? There is difference in access. Medicare Advantage plans have a limited network. You need to find out if the physicians and services that you want are going to be covered in that network. There's a difference in cost to the consumer, and this is kind of what I was alluding to earlier. There's a maximum out of pocket that could be almost $8,000 if you're on a Medicare Advantage plan. Read that fine print. Some of them are less, some of them are like $3,000. If you're gonna pay for, if you're on traditional Medicare and you have a supplement or Medigap, you're gonna pay about $2,400 a year, where your maximum out of pocket on an Advantage plan, if you have to go to specialists, their co-pays, and all of that's gonna, if it gets up to $7,500 before it stops, right? So that's your maximum out of pocket. I'm gonna let Sarah handle the questions and answers, and I will stay quietly for a few minutes.
Rest your voice.
Rest my voice.
Hi, everybody. Okay, Chuck just asked me to discuss some of the questions that we get commonly in the accounting department. So one of the biggest questions we get from residents that have experienced a stay, typically over in the health center, is why isn't Westminster in network with all Medicare Advantage plans? Well, the simple answer is we're not in network with any of them. If we did that, I mean, like Chuck mentioned, there's 8,000 plans, right? So we can apply to be in network, but typically the margin on that, how we would make the money is it's not enough for us to be in network with all of those plans. So we're just not. The reimbursement is too low. So what happens when I'm on a plan that Westminster is not in network with, okay? So we can negotiate on an individual basis with those providers and try to get the best rate for the community and for you. Sometimes that works, sometimes that doesn't work. So, but like Chuck mentioned and Ms. Peterson mentioned, you have a life care benefit. You're already here at Westminster. So even if we can't accept your out-of-network plan, you're not going to be refused services for the health center. We'll just have to put you on your life care benefit at that time. Does that make sense? So if we do bill you for a copay, so you go over there and we bill Medicare, and then we send you a bill for a copay. We get that question all the time. Michelle, why did I get billed for a copay? Well, when you use your Medicare or Medicare Advantage for a stay over in the health center, it's like if you go to the doctor and you pay a copay. Your Advantage plan or your Medicare is going to bill Westminster for services. Now, that's where your supplemental or your Medigap comes in. So why is the copay so much? Medicare copay is $194.50 a day for your stay over at Westminster for skilled services, a temporary stay, not a permanent stay, a temporary stay. Like Chuck mentioned, you break a hip, you go over for therapy. Medicare is, we're gonna have to charge you a copay of $194.50 a day. In 2023, that goes up to $200. Now, if you have a Medigap or a secondary insurance, that typically covers your copay. And you'll never see an additional bill from Westminster other than your 2 additional meals or maybe some additional nursing supplies. So I encourage you to have a supplemental or a Medigap insurance. So Chuck mentioned this, we get this call all the time. Sarah, what insurance should I use? I can't tell you that. I can encourage you to read the fine print. I can encourage you to talk to some loved ones to see what your peers are doing, but Westminster can't recommend an insurance plan to what would cover for what's right for Mrs. Wright or what's right for Mrs. Kelly. You all have different needs, and one size does not fit all. So this is another one, and I just asked Chuck if we could throw this one in here too, because we get this question quite a bit. Should I keep my long-term care insurance policy? Not your Westminster long-term care insurance. How many of you have supplemental long-term care insurance? Great. And many of you have had that long-term care insurance for years and years and years and years. And then every once in a while, I'll get a call, my long-term care insurance is going up. Should I keep it? I can't advise you on that. I can tell you to read the fine print, to see what it covers. If you end up going over to the assisted living or to the arbor, typically those long-term care insurances will reimburse you for your stay there, if it's a long-term stay. So essentially your monthly fee would be paid by your long-term care insurance. Typically, you would need to read the fine print. If you've been paying into that program for quite some time, and you think that you probably will use a higher level of care, it might be worth it for you to decide to keep that insurance. But I can't really advise you on it. I can help you read the fine print, but that's about it. So what does it say in our life care contract? So all of you have a contract, and sometimes you have copies of them and sometimes you don't, just depends on how long you've been here. But I mean, it's real, right? But we have a contract, we have copies of your contract, so if you want me to send a copy of your contract at any time, please just let me know. We have that for you. But section 4.2, temporary assignment to assisted living, memory care, rehab care, or nursing. If you are temporarily assigned, meaning for any reason you're in your life care residence and you have an event that you need services and a higher level of care, so you may need assisted living or health care, your assisted living care, memory care, rehab care, and nursing care will be provided without extra charge by us. You can go over there, right? It's in your contract temporarily. You will pay the charges for the meals in excess of the dining dollars allotment included in your monthly fee. So you will be paid, we will charge you essentially for 2 additional meals. And then the current charges for any additional services as described in paragraph 4.7. So let's go to a different paragraph. If your stay in the health center is fully covered as a Medicare qualified stay, this benefit will not take into effect until the termination of your Medicare qualified stay. What does that mean? All right? You all can go over there either temporarily under your life care benefit or your Medicare benefit. Okay? If your Medicare benefit runs out, because there's days, they say you get 20 days here, 20 days here, and then you have another 80 days, and it depends on how you improve. What am I doing wrong? Is it you? Okay, it's Chuck. Could you just stay still?
Not really.
I know, it's hard. It's hard for you. So anyway, if you go over there and if you max out your 100 days and you still feel the need to be there, your life care contract covers that. Your life care contract with Westminster covers that. You can still get the services. Like Chuck mentioned, you may need additional therapies, whatever the needs may be. We may be doing Medicare B, billing Medicare B for your rehab. There's a lot of different variables, but you can still receive services over in the Arbor, even temporarily. Okay? And then that's it. That's pretty much it. So those are the questions we get a lot in accounting. Any other questions? I know it's confusing. Because I get questions all the time. Yes, Ms. Corwin.
What if you have separate stays?
Say it one more time.
What about separate stays? You're 120 days there
Mhm.
for something,
Okay.
and then it runs out, but what if 2 years later you go in for a different?
It rolls. It continues to roll. You can have 100 days, in April of 2022, and you've reached your maximum improvement. Everything's wonderful. You go back to your residence. Everything is fine, and all of a sudden, 6 months later, you have another event, completely separate event. You go to your 3 midnight stays in the hospital. You come back. Your benefit renews with Medicare.
There is a 60-day break, wellness break required between stays.
But with Medicare Advantage plans, that depends on the plan that you're in. I'm sorry, Maria.
That's okay.
It depends on the plan you're in. And I don't know what each Advantage plan says.
We have another question back here.
Yes, I've been here 4.5 years, and I don't know who you are. Could you
I'm sorry.
give us your name?
I'm Sarah Lloyd. I'm the Associate Executive Director here.
And what is your extension number if we needed to call you?
It's very 2222. Number 2, 2222.
And if we wanted to, what this meeting here today has done for me is to show me how much I don't know.
Right.
And I don't think it's a good idea to have so many people. It really needs to sit down face to face, 1-to-1, because you don't know what our particular problems are.
Well, and that's a very good point. Everybody has, so this presentation is kind of a one-size-fits-all. Essentially, we're telling you don't know what you don't know, right? We're asking you and encouraging you to educate yourself on your specific plan, on your specific insurance plan. I would also love to tell you that we had resources to sit down with all 500 of our residents individually and help you make that plan. Unfortunately, that's not something, we just don't have the resources for that. But if you have a specific question we can answer for you about your stay in the health center, we can certainly help you with that, or rehab within the Westminster realm. Now, if you have questions about hospitalization or your medication, that may be outside of our scope. But what we're encouraging you to do today is to educate yourself and ask for help.
And reach out to the resources that we're providing you on that handout. So there's a lot of
But
resources available.
we do try to answer as much as we can about those individuals. And yes, ma'am.
Will we have access to those?
To those slides?
Slides?
Yes.
They're different than the one we have here.
Chuck will
Yeah,
make those
the
available.
slides that you have on this table back here are a little bit more detailed, but it pretty much says the same thing. They're just more detailed. I didn't want to put all this detail on these slides because you wouldn't be able to read them. It's
He
ridiculous.
didn't want you to get ahead of the presentation.
That's pretty much it.
He wanted to save it. Now he'll make it open. She asked if it's gonna be on the portal,
Yes.
these documents.
Yeah, Ruth's gonna post it on the portal and the recording of the presentation as well. Anything else? Everybody okay? We're okay. We're extraordinary together because we're Westminster, right? We'll be okay. The good thing, the blessing is that, again, you all have a life care benefit here, regardless of whether or not your Medicare or Medicare Advantage plan leaves you in the lurch. We're never gonna leave you in the lurch. But there are a lot of resources out there. There's a lot of information. Don't fall for the hype, right? Don't switch if you don't need to switch. And then reach out to your resources and try to find out everything that you can before you make a decision to switch, and get your family involved and work together, okay? Thank you all for coming today. We'll post this on the portal as well as the slides and handout. Thank you.